In the ICU specifically, we have a multidisciplinary team to help care for these patients. We, in a collaborative fashion, work with neurologists and neurosurgeons to manage the patients. That adds to patient care because we're able to look at problems from different perspectives, and that helps with patient management. Most of our patients are transferred from outside hospitals with usually acute, devastating neurologic or neurosurgical conditions. In the early hours, we focus on brain resuscitation, trying to minimize any secondary injuries to the brain that could worsen whatever has happened. But we not only focus on the brain, but also on all the other organs that help sustain the brain. We pay particular attention to the heart and the lungs and make sure that all the body functions are appropriate. We also try to devise a plan of action for those very early hours to try to minimize brain injury. For a family member, it can be a little bit of a daunting, difficult experience. We focus certainly on the patient first. A big part of our job is to try to counsel the family and keep them updated and let them know what to expect over the next few hours and days after admission to the ICU. The percent of patients that come from elective surgery tends to be lower, about 10 or 20% at most. While they may not be fully awake, certainly are less sick in general than patients that have had a devastating injury. We focus on making sure that we continue the post-op management that has been instituted in the OR and in the PACU recovery area. And usually that has to do with neurologic assessments to make sure that there are no complications that have taken place in the post-op period. We also focus intensely on pain control. We actually are very vigilant and have a number of protocols that have successfully reduced the rates of infections in our ICU. Regarding mobilization, we have a program of early mobility, both for the post-op but also for patients even with acute brain injuries. Once they have been stabilized and the acute period is over, we try to start the rehab process early on in the ICU, whether that means passive range of motion, whether that means just taking them out of bed and putting them up in a chair to enhance that recovery process. The advantage of coming here is you're going to get a team of highly specialized people who do this day in and day out. We have the sickest patients of any neuro ICU in the country, so we are quite well versed in how to manage these patients.